week. Today we are joined by the wonderful Demi Wolford, a 2020 grad from St. James University. And we have Roland, Dr. Roland, can't forget that, our wonderful USMLE prep counselor. So hi guys, thanks for joining us today.
Yeah.
Thank you so much, Megan.
Hey, Demi.
Hey, Roland.
So thank you, everyone. Happy, oh my gosh,
Thursday.
What day is it? Thursday, yeah. Happy Thursday.
We've been in quarantine for too long. We kind of forgot what day it was.
Megan let us out the
as
basement to do this stuff.
Yeah, as a disclaimer for everyone, Roland and myself are in Chicago right now. So if we expand, Dr. Wolford is in Texas dealing with all the frozenness.
Yeah.
So if there are any technical difficulties or lagging, just bear with us. We are, going to keep going.
Awesome.
So without further ado, we're going to start our pro question. Roland, do you want to share your screen?
I am ready.
Okay,
so
perfect.
Today's question is about a pain in the foot. So today's objectives, how we're going to run down today. We're going to go over the question of the week with Dr. Wolford. We're also going to give you another question. So it's 2 for 1 today. So another question. And then we'll demonstrate how to review a more challenging question, a relatively poor question. We're also going to go over how to study renal pathologies from 2 different perspectives. And that's our today's goals and objectives. So here's the question of the day, right? And I'll just read it. We have a 42-year-old man coming to the clinic with complaints of pain, redness, and swelling of his right big toe for the past 2 days. Pain 6 out of 10, non-radiating with no alleviating or aggravating factors. Patient has a history of diabetes, mellitus, and hypertension. Current medications include Ramipril and a daily multivitamin. The patient is allergic to aspirin, does not exercise, and his diet consists of heavily of red meat and beer. Physical exam demonstrates right big toe erythema, seen right here, tenderness and tophi formation of the right metatarsal phalangeal joint on the right foot, which is right yonder. The patient is unable to bear weight on the right foot due to pain. What is the most likely adverse effect for the new medication that will be prescribed for his patient's condition? Answers is below. So for those of you who have not had the moment to do this question, take a look at it, write in the comment section what you think is going on, and then we'll have Dr. Wolford take it from there.
Awesome. Let me know when I should jump in or give just a second.
Yeah, we'll give them a minute or two for
Yeah,
those.
we'll give them a sec just for everybody to plug in their questions or answers, whatever they think it may be. And then you can start kind of breaking it down of what things that you first pick out when you're looking at this question.
Awesome.
Did you go sledding, Dr. Demi?
I did not. I did get in the hot tub with my family. That was awesome. And then all of our pipes froze, so it didn't work anymore. But it was fun for one nice tub swim, with the snow and the ice, and I was eating snow in the hot tub. It was awesome. It was awesome. But I did not sled. You
enjoyed it while it lasted.
I did. Yep. First and last time, I would hope that we have that much snow here. It's just been insane.
Do you want to start breaking it down, and then hopefully we'll get some more answers coming in?
Sure. Okay. So when I'm reading this first of all, what I do is I look at the age and the gender. So it's a 42-year-old man. So right off the bat, that kind of narrows down what I'm thinking about. So he comes in, he has pain and he has redness in his right big toe for 2 days. So just me, whenever I think of pain in a joint, first of all, gout is kind of the number one thing that I think of. Other than that, any arthritis type thing, it could be a septic one or an autoimmune one. Those are just some of my thoughts. Looking at, he is diabetic and he has hypertension, what his medications are. He is allergic to aspirin. So I'm going to make a mental note of that, because anytime that they mention that a patient has some sort of an allergy, that can often be kind of like a red marker. That's a big thing. They wouldn't say that unless it pertained to the answer. He doesn't exercise and his diet is heavily red meat and beer. Okay, I'm thinking this guy has gout. Poor guy, because I've heard it really, really sucks. So he is, yeah, there's a tophi, okay, in the joint on the right food. Joint on the right food. Did you catch that, Roland?
I did not, but thank you, Dr. Wolford, for calling me out on that.
And that's all right. So then what the question, Sam, is what is the most likely adverse effect for the new medication? Okay, so what I'm thinking is if he's going to be on a new medication for gout, there's the acute and the chronic meds. For acute, you can obviously treat them with NSAIDs or with colchicine. Now, what did we point out here? The patient has an allergy to aspirin. So I'm going to say what the question is asking us about is what the most likely adverse effect of colchicine is. Okay, so colchicine, to be fair, guys, I actually had to ask Roland what the answer was for this one, because it's a challenging one, because a couple of these here can be caused by the medication. So obviously that's a side effect of a lot of medications. Often that can be seen in like anti-cancer drugs, that you see that. B, with diarrhea, I know that this is a side effect of the medication. So that's flagging me there. Phototoxicity, when I think of that, I think of the tetracyclines. That's what I think of when I think of that side effect. D, with pulmonary, I think of amiodarone. Amiodarone is the one that I think of where that's the side effect that they commonly test that on. And then E, any hepatotoxic issues, I often think of the TB drugs, rifampin, there's isoniazid and pyridoxine. Those all cause that. And that's maybe not something that I think of when I think of colchicine. So obviously I went with B because I was told that was the right answer. But also what it's asking is what is the most likely adverse effect? So some of those choicey words there, most likely, B is my answer.
Yep, that's absolutely correct. So for those of you watching, correct choice is B for beta. Patients being managed with colchicine, side effect is diarrhea. Just to echo Dr. Wolford, so she mentioned option choice D is in delta, pulmonary fibrosis. Completely agree with her. Two more medications that came to my mind when I was doing this question was bleomycin and bolsafan. I think in the first aid, they have the chemo bear. Those are two medications that came to mind for me. So yeah, well done. So for those of you who are playing along, hopefully you got it right. If you didn't get it right, completely okay. You know, kind of do exactly what Demi did, saying, here's the presentation of the patient. Here are 10 differentials that pop into mind immediately. Work your way down to most likely, and then once you have that, think about the most common treatments for both acute and chronic. And like Dr. Wolford, patients allergic to aspirin, ding, 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 big red flag. What do we need to do from there? So yeah, really good. So this is a quick summary of what Dr. Wolford did and something that I kind of try to drill into my students as well. So a lot of my students, they go into when they're doing UWell, they do a vignette, they do an answer, they read everything really quickly and move on, which is okay. I kindly suggest doing it this way. So take a step back, look at the vignette as if a patient walks in through your clinic door. So I know that CS has been canceled, but kind of view it in that aspect. So a 42-year-old man walks into your clinic door, he's holding his foot, he's hobbling a little bit. What is the likely diagnosis, right? So what's the most likely diagnosis? 10 or 12 things. I think Dr. Wolford said, what, septic, rheumatoid, osteo, The second thing is, what's most likely pathophys? So what's leading to that condition? Third choice, how do we manage it? Right? Is the condition acute versus chronic? The fourth thing, just like what Dr. Wolford said, what kind of conditions does he has pre-existing to change it to something else, right? And the fourth part, what kind of interesting tidbits or trivia does the MBME in step one like to for you to know about? So, for example, colchicine causing diarrhea, right? Even though you got the first three parts correct, if you missed that tiny little tidbit, you could have gotten the question wrong. Okay, so let's try again, right? So this is a second question. It has not been placed on Facebook or all the fancy social media that Megan is a wizard of. Let's go through it together. So once again, let's go through this together. For those of you watching, please play along. I mean, we're not judging you either way. So kind of a learning module for all of us, right? So what do we have? We have a 15-year-old boy. Oh, I'm sorry, one more thing. So I strategically removed a large amount of information, right? So I made this question poor, and by that I mean I took out a bunch of critical information, and you'll see why in a little bit. But a 15-year-old boy comes into a physician because of fatigue. Okay, that could be 1,001 things. Physical exam is unremarkable. We do a urinalysis, right? So you can kind of see that I took out the labs, I took out the vitals, I took out the H&P, I took out everything except for a urinalysis. 15-year-old boy with fatigue, right? So let's take a look at the urinalysis. What do we have? A little bit of protein, okay? A little bit of blood. Glucose, ketones, and esterases are negative. Nitrates are negative. WBCs, I believe that is okay. RBCs are a little bit high. And then the CAS, you have RBC CAS. So a little bit of blood in the urine, right? No crystals. We decide to skip forward a couple of steps. We do a kidney biopsy. Right, so what do we have again? 15-year-old boy, fatigue, urinalysis demonstrated blood, hematuria, and we drill into his kidney and we see this. I'm sorry, one more thing, light microscopy, right? We're doing a light microscopy of his kidney. We see this beautiful picture right here. So for all of you playing along, what is going on, right? What do you see? Okay, yeah, definitely a possibility. Keep them coming. We'll see how many people are studying renal or have studied renal. But Dr. Wolford, when you were studying, which one was your most challenging subject?
Man, this was hard. I mean, there's just so many different pathologies in this process. I mean, I watched the pathoma videos on this maybe about 1 million times. And it's one of those things that I just have to brush up on every 6 months or so. And as I start to study for step 3, that's going to be a process going back through this.
Yeah, absolutely.
Yeah.
So once again, for everyone playing along, what do we have? We have a 15-year-old boy with fatigue, hematuria upon a urinalysis. We drill into his kidney and we see this. So huge clue right here. Right. So what kind of additional findings are we most likely to be found in this patient? So going back to 1 through 4, what do we do, right? What is the most likely, give me some differentials, right? Let's move back. Step one, give me differential. So I think one wonderful student said Berger's disease, someone said nephritic. Absolutely. Name some pathologies that could cause this. Right? Just drop it all into chat. Let's see what you guys think.
Is there any way that we could go back to the labs?
Sure, absolutely.
Yeah. Okay.
What are you thinking, Dr. Woodford?
So what I think here is, so like I said, the first thing that I see is I look at the age and that it's a boy, it's a young boy. That kind of points me into one spot, but I won't go there just yet. I'm looking at the labs. So one thing I know that Dr. Zhang said that he kind of tore back a lot of the information in the question and really just gave us what the bare bones were. I think that knowing labs is so important, and you can get by so much faster if you know kind of what a normal range is, rather than in the test have to click to the lab sheet. So if you really know labs super well, you can look at this and kind of say, okay, there is protein. So both nephritic and nephrotic can have that seen. So, okay, I'm taking that with a grain of salt. But I'm looking at blood trace. We have white blood cells and red blood cells and casts that are red blood cells. Okay, that tells me that it's nephritic. And I think Deep also said that the slide seems like that too. If we could actually go to the next slide. I was the person that wasn't really good at looking at the pictures of like these paths. So what I can tell here is that it looks like there's a lot of cells there. And so that kind of goes with the nephritic, the process of having these like inflammatory things going on. It's bringing other cells there. So that's kind of narrowing me down to half of the pathologies in this area. And then if we could go to the next slide. Yeah, which are the additional findings? This is one of those things where you have to know all of them so well to be able to, pick apart each of these answers. Dr. Zhang, what are you thinking now? I want to hear your thoughts.
Sure, absolutely. So just like Dr. Wolford, when I did the question for the very first time, same thing, I did have the luxury of having more information, which was actually not relevant to the question, which is why, for sake of time and brevity, kind of took that out. Same thing, 15-year-old boy. So I'm really thinking, okay, younger patient, right? Complains of fatigue, just fatigue, nothing else. Right? He doesn't complain of hematuria. He doesn't complain about abdominal pain, just simple fatigue. Then same thing, urinalysis, so proteinuria, hematuria, right? So basically some kind of inflammation, could be damage. Could he have some kind of malignancy? Yeah, maybe, but more than likely, MBME step one, they love to ask about nephritic, nephrotic. So kind of putting myself in the test taker shoes, what are they trying to get at? So more than likely a renal question, nephritic versus nephrotic. Then here, so they give you the slide, so saying, do you recognize what's going on? 15-year-old boy with proteinuria, hematuria, boom, this slide, what do you think, right? So the question is, based upon your diagnosis, what kind of issue, what additional finding is based on that? So almost like a tertiary question. Do you know what's going on based upon the histology slide? Do you know the diagnosis? What's no diagnosis? What additional trivia you know about that? So Ms. Megan, any answers from our wonderful viewers? Any guesses? Don't be shy.
So we have couple. Well, we don't have any actual A, B, C, D, or E.
So give 20 seconds on the clock.
Yeah. So we're gonna put a couple more seconds on. If you guys want to type. Oh, we have someone saying A.
Okay, fantastic.
Let's give it a little bit more time to see if anybody else wants to type in their answer, and we'll go over the correct one in a couple minutes.
Yeah.
Awesome.
So Dr. Wolford, one thing we were thinking of was that maybe we can have some kind of trivia for the student who gets the most correct answers. We can give them a T-shirt with Megan's face on it or something. You know? Like,
Yes, because I think
T-shirt.
everybody wants.
She is the backbone of this school now. She.
Oh, okay. Well, I offered to have my face, but I think that's automatic. No, anyone but you. So, right. We have some more A's.
Put your face on a keychain.
Put my face.
A is a
So we're
popular.
getting,
Okay.
yeah, we're getting a lot of people saying A.
Let's
give it a couple more seconds just to see if anybody wants to type in a last-minute question or answer, and then
bonus points if you can write out why you think it's A. So what made you think A? Obviously, don't just write because of the histology slide or because of the slide. Like, what made you choose A out of all the other choices?
we're getting you thinking.
I mean, this is a tough one. I will say this is a really, really hard one.
Yeah.
What would you say the answer is, Demi? Oh, we have somebody who's questioning it and says D.
Fantastic. Okay. We got a D. Keep them coming. Keep them coming. All right, Dr. Wolford, I don't think I gave you the answer to this one, did I? Or did you sneak a peek at my PowerPoint?
I mean, I looked at first aid, man. I was like, wait, what is this again? So I don't necessarily want to give mine away, but I do want to talk about them. I'd like to talk about A.
Yeah. You want to compare A versus D because those are the two answer selections that we're seeing.
Yeah. So A and D were my choices. So A, I'm thinking, okay, isn't that Good Pastures? Is that good Pastures, Dr. Zhang?
Is it Good Pastures or Wagner's? I want to say Good Pastures because of the basement membrane, right? The floor at the membrane.
Yeah, I think it's Good Pastures, which I don't think is a bad answer because can we actually go back to the labs? So they're talking about, okay, so there's some blood in the urine. Okay, but the thing is, the image that they gave us was light microscopy, and with Good Pastures, that's seen on what is it?
I want to say the mesangium or the lamina propria pops into mind. I will have to double check. So for those of you watching, I apologize. I can't think of it at the moment. Maybe we can do a edition back in online, like, we
can put a
addendum. But I agree with Dr. Wolford. So this right here, right? So I agree. Good Pastures will be a great answer choice if they did not give you this slide. So this slide, I think, like Dr. Wolford mentioned, a lot of hypercellularity, right? A lot of stuff going on. And then these right here. So going back, right? What are these? So the correct answer is actually D, right? Yeah. So D for decreased C3 level. So for the one student who picked D, congratulations. Expect your t-shirt with Megan's face on it in the mail. Give it a couple months to design it. But
you're
back, so going back, what happened in this patient? So once again, very, very poor question, right? I took out a lot of material to kind of get you the gist of it. It's basically an inflammatory process, a nephritic process, most common in children. So even though he's 14, 15, still on the younger side. Right? Yeah. Most common after a group A streptococcal infection, right? Can progress to renal insufficiency. So this is the first aid explanation. And you can see all the stuff that we kind of mentioned briefly. Show the peripheral periorbital edema, the T or cola-colored urine, right? So here's the answer right here. Decreased complement C3 levels, lumpy, bumpy, and you can kind of see it right here. Let's take a step back, right? So we know is post-streptococcus glomerulonephritis. We know that the patient was probably exposed to group A strep a couple of weeks prior and then presented this way. I have a love-hate relationship with first aid because it doesn't really teach you the material, right? So it gives you this stuff kind of in sequential order, and a lot of my students, they kind of memorize this, but they don't understand it. So I want you to take a step back to take a look how to look at this, right? So this is my personal strategy. Please feel free to try it. Please feel free to disregard it. But here's how I study the nephritic versus nephrotic syndromes. First one, I look at the basic function of the nephron, right? The whole podocytes, the mesangium, what the heck was nephron? Try and drag me back to MD1. I'm sure my anatomy professor will probably hate me, but I had to kind of jog my memory. What does nephron do? You know, the whole loop of Henle, PCT, DCT, all that fun stuff. This was a great website for me because it explained to me like a 10-year-old, like what do I really need to remember about that, right? If you want to read Harrison's, you're more than welcome to, but sometimes I just need to ELI5 and explain to me like I'm 5 years old one more time. Second thing, I broke it down to nephritic versus nephrotic, right? There is some interconnection, but let's separate them for now. Nephritic, we have 1, 2, 3, 4, 5. Nephrotic, 1, 2, 3, 4, 5. And I focus on each one individually. Then the third part was that I looked at it again from the patient walking to your clinic door. So the pathophysiology, what kind of clinical features. So let's say this same 15-year-old patient walked into your clinic door. He had the red puffy eyes, he's lethargic, not really talking, kind of hunched over a little bit anemic looking. Tells you that he's been peeing cola-colored urine. And same thing, what do you expect to see on labs? So even though on the vignette they may say hematuria, they could give you this, right? They might just give you that in word form. They might just say WBCs are X amount, RBCs are that amount. They might give you a picture of a RBC cast, right? So even though first aid gives you this in word form, I would recommend understanding them or actually looking at them. What does this actually look like? Cool. And then the fourth part, I actually took the time to draw it out in flashcards. So all the nephritic, I think there was 5 or 6, all the nephrotic, 5 or 6, and the mixed. I had a flashcard about good pastures or post-strep glomerulonephritis. On the back, I wrote down this, and then I drew a very small image on the flashcard as well, right? Old school with colored pencils. And one more thing I recommend, kind of echoing what Dr. Wolford said earlier, if you do this correctly, you don't need to do it again for step 2 CK or step 3. Right? You kind of have your own cheat sheet, your own flashcards as you evolve, adapt, and move forward. And as you're doing more questions, as you become more experienced, add stuff to the flashcard. So they'll be your new best friends. But Dr. Wolford, do you have any suggestions or advice of how you study for renal pathology?
Yeah, I mean, it was obviously hard. So I love first aid. I love first aid very much. We clearly are not the same in that.
This video is no longer sponsored by first aid.
First aid.
I mean, but I will say in this section here, I think it lacks. I think there's so many kind of really tight points here that it's just hard to kind of break it apart. I used to write this out by hand over and over again on my pages. I mean, I anything that kind of takes it out of this very sterile way, I think helps. So I watched Pathoma on it about like 1 million times, but not only that, I would just watch like any YouTube video that I could find that kind of broke this apart. Just hearing a bunch of people kind of talk about it in a different way, draw it out in a different way, gave it more life to me. And that helped. And then once you learn it well, you can come back and look at this and it will make sense. You can't learn off this, just like you said. You can't. It's sterile and this is like the worst page. I can't stand this page.
Oh, I think you're absolutely right. Because the first aid, let me kind of change my my theory of first aid. First aid is a
Oh.
review book, right? It's a review book. You shouldn't learn from a review book. You should understand it and here's everything condensed. So I completely agree. My mistake. So yeah, absolutely. So this question once again, post-strep glomerulonephritis. The option choice is D, right? So that is it in a nutshell. I do want to kind of give you a couple of references to how to kind of take it to the next level. So one thing was that we talked about complement levels. So for those of you who actually remembered it, let's say you memorized this part, memorized this part, decrease C3, fantastic. What's a complement? You know, actually $5 to Dr. Demi if you know what complements off the top of your head.
Come on, guys.
Because I had no idea.
Me? Okay, so they are the factors that go in place to start an inflammatory action.
Yep, absolutely. So they're synthesized in the liver. So five points to Gryffindor. Hufflepuff? You look like a Hufflepuff. So they synthesize in the liver, and when you have an inflammatory infectious process, they actually clumped up. So it actually decreases the amount of proteins because they're used up, right? So because they're used up, they actually decrease. So you have a low C3 level. For those of you who are St. James students, we have a very strong library. So if you go to sjsm.org and library, you have a lot of wonderful resources, Access Medicine, e-medicine, a lot of great textbooks for free. And I would recommend, logging on, type in post-strep glomerulonephritis, and kind of learn about it, right? If you can't log in, I would recommend emailing our librarian, Oscar. She'll be happy to help you out. And if you have the first aid, this is the page I pulled it from, acute glomerulonephritis. So thank you, everyone. Any questions, thoughts, concerns?
Roland, do you want to show them show our viewers how to locate the library page within the St. James website?
Yes, thank you. I forgot about that. So application window.
Teamwork.
So teamwork makes the dream work, right? All right. So you go to the main homepage, sjsm.org, go to resources under library. So resources under library in here, right? So these are all fantastic links. The two I really like are Access Medicine and Dynamed. Dynamed is almost like up to date, but that's our version. If you click on it, you will have to add your username and password. If you don't have one or forgot about it, email Oscar here. And that is it. Okay, so thank you everyone for joining our webinar. Any questions, thoughts, concerns? If the question was too easy or too challenging, or if you have a topic you want to go over, email Megan, not me, Megan. No,
or you can always
email
post it in the comment section.
Yeah, absolutely, any one of us will be happy to go through. But yeah, any questions, thoughts, concerns?
That was awesome.
Thank you so much, Dr. Woodford, for joining us from the cold and frozen of Texas.
Yes, of course. This was awesome. Y'all are great. I'm just thrilled that I could be here to hang out with you guys. What's a good tool to review topics? That's a good question. Review. I'll tell you one thing that I did prior to every test that I take. I would actually look at first aid step 1. I would speed read it from cover to cover, other than first aid deep.
He knows.
I mean, honestly, one of the best things that you can do is just go through UWorld and just be absolutely just slammed by it. And that really helps you learn. I mean, that's kind of one of the things that I still do now. I'm on UWorld step 3 and I'm like, man, some of my test grades are pretty low, but you learn and it sticks and it reminds you of what you once knew. And honestly, I know you said other than first aid, but I still use first aid step 1. I still use it. It's a resource that if you learn it well, it makes a mental map for everything. That's me.
So one thing I use, something a little bit different, I had a couple study buddies that I found through Reddit and Skype, and I actually found my old Step 1 notebook of all things. And so what I recommend, so how do you review topics? One thing that I use that we each study, nephritic versus nephrotic separately, let's say for a week straight, then we will quiz each other. Like, hey, for example, Megan, tell me about which disease will have a low C3. You'll shoot it out. So really fast that, even though you think you know it, under pressure of someone asking you directly, do you know that? Or even more importantly, let's say I have no idea. Can you explain to me in your own words about post-rep, right? So kind of in summary, boom, almost like a grand note. But when I was studying, I had little notes. So I'm not sure if you can see my notebook about, the concept, okay.
No, I see it.
Ancient artifact.
Oh, thanks. Thank you.
Wait, we'll zoom you in.
So let's say here is a acute inferior MI. So I had a little drawing about the acute inferior MI, and kind of walk my way through that. Right? So what do you see? Do you have a JVD and so on and so forth? So when I was reviewing topics with my study buddy, I'll ask them, okay, I'm a 45-year-old patient. I have acute inferior MI. Walk me through it. And kind of, I have my cheat sheet. So by hearing them talk about it, I can also teach them or correct any mistakes they made. So a little quid pro quo. Cool.
Awesome.
That's great. I mean, honestly, I think writing out anything just kind of helps it all stick. And I mean, I'm a very visual person. So whenever I draw something out or, things like that, it just kind of clicks into place and you're just like, okay, I remember I wrote it down somewhere, and that repetition really helps. So thank you both for your expertise and helping with your study tips. And it'll help our viewers.
Awesome. Thank you, Megan.
Of course.
Thank you so much.
Thank you guys all for joining us today. And we will see you not next Thursday, but the following Thursday with another Facebook Live event. Bye, everyone.
Awesome. Thanks,
Take
guys.
care. Stay warm.